Welcome again, everyone. I am your host, Jasmine Coelho. We at the New York City Council thank you for joining us for the new series, Chat and Chew. Chat and Chew sessions are community conversations about different topics. This session will focus on public health concerns about the status of the MPV, polio, and COVID-19. Please note that today's Chat and Chew session is being recorded. We are joined by advocates, members of the City Council, and the city's first Deputy Commissioner and Chief Equity Officer of the Department of Health and Mental Hygiene. We'll get into introductions shortly, but first, words from the Speaker of the New York City Council, Adrienne E. Adams.
Greetings. I'm New York City Council Speaker Adrienne Adams, and welcome to Chat and Chew. Thank you for taking the time to join us for this important conversation about getting vaccinated against COVID-19 and the monkeypox virus. Today, we will hear from health experts and advocates about these viruses, what our city is doing about the outbreaks, and how you can play a role in our efforts to stop the spread. As we begin the month of September, we're quickly approaching the start of the school year, as well as the West Indian Day Carnival festivities. There is no better time to make sure that our children, families, and communities are up to date on our immunizations. Whether it's for COVID-19, monkeypox, polio, or other diseases, getting vaccinated is the best way to stay safe and healthy. I encourage everyone to get your vaccine shots and listen to our public health professionals. Thank you to the City Council's Health Chair, Lynn Schulman, Education Chair, Rita Joseph, the Black, Latino, and Asian Caucus, the LGBTQIA Caucus, and our Community Engagement Division for hosting today's Chat and Chew. Have a fantastic discussion, and let's continue to work together to reduce the spread.
A special thanks to the speaker for hosting this effort. Our panelists for today's Chat and Chew sessions are caucus and committee chairs. Oswald Felice, co-chair of the Black and Latino and Asian Caucus, Rita Joseph, chair of the Education Committee, Lynn Schulman, chair of the Health Committee, and chairs and members of the LGBTQIA+ caucus, Chair Crystal Hudson, Chair Tiffany Caban, Councilmember Eric Bottcher, and Councilmember Schulman. We'll start with brief remarks from the chairs. Councilmember Schulman.
Thank you. Good afternoon, everyone. I am Councilmember Lynn Schulman, Chair of the Health Committee for the New York City Council. I want to welcome and thank everyone for joining this incredibly important virtual Chat and Chew on monkeypox, polio, and COVID-19, our current public health crises. I want to especially acknowledge and thank Speaker Adrienne Adams for her continued leadership and support on these issues. I also want to acknowledge some of my colleagues who are co-hosting this event today. Education Chair, Councilmember Rita Joseph, the LGBTQIA+ caucus chaired by Council members Crystal Hudson and Tiffany Caban, and the Black, Latino, and Asian caucus represented today by Councilmember Oswald Felice. The city is doing a lot to address these viruses, particularly with disseminating educational materials and getting people vaccinated. Unfortunately, with monkeypox, which we prefer to call MPV, vaccine availability has been sparse due to the indifference and inaction of the federal government, which we are all working to address. With polio and COVID-19, we are lucky to have vaccines readily available, and I urge everyone to make sure your polio vaccines are up to date. If you were vaccinated as a child, you are still covered, and the city's Department of Health can give you more details on how you can get that information. Also urge people that aren't vaccinated to get vaccinated and boosted for COVID. The Department of Health and Mental Hygiene has been working closely with the council on these public health issues, and we look forward to listening to those who are here today and looking at productive ways we can all work together to make our communities healthy and safe. I have dedicated my personal and professional life to healthcare advocacy, which was born out of the HIV/AIDS movement when I witnessed friends and neighbors die needlessly because of the indifference of those in power. I saw that same indifference with COVID and now with MPV. As chair of the City Council Health Committee, I am committed to ensuring all New Yorkers have access to affordable and equitable health care, which is the only way we can address the current viruses and be prepared for the next public health crisis. I want to take this moment to acknowledge and thank Commissioner Ashwin Vasan, First Deputy Commissioner Torian Easterling, who is joining us today, and the entire Department of Health and Mental Hygiene for being responsive and collaborative on these important health concerns. When government entities, advocates, and elected officials coordinate and work together, New Yorkers get the best results, and I am confident that we are headed in the right direction. Thank you again, Madam Speaker, for your support, and I look forward to a productive session. I now want to introduce my colleague, Councilmember Rita Joseph, Chair of the Education Committee in the City Council, to say a few words.
Thank you, Councilmember Sholin. I appreciate that. Happened. Give me 1 second. All right. Good afternoon. I'm Councilmember Rita Joseph, and I have the privilege of representing Flatbush in the City Council. I'd like to thank Councilmember Shulman, Speaker Adams for their partnership in putting this event together, as well as the partnership of the LGBTQIA+ and Black Caucus. It's so important that we have this discussion because there's a lot of misinformation surrounding both monkeypox and COVID. And I think it's key that we rather spread facts rather than fear. I'm incredibly grateful for the medical experts who are taking the time to join us today and who are lending their expertise. Some of you may know that I'm a teacher, so I'm here to learn as well, so I can be a better partner. I'm learning and excited to learn things through this discussion. Last but not least, for anyone, thank you so much for your partnership, and I look forward to listening and learning. Thank you.
Councilmember Feliz. I don't think Councilmember Feliz has joined us as of yet. If we could go to Councilmember Lewis. Is Councilmember Lewis, has she joined us yet? All right, Councilmember Hudson.
Thank you. Good afternoon. I'll keep it really brief and just thank everyone for joining this chat and chew today. And thanks for everyone in the speaker's office and the speaker for organizing it. It's really important that we continue to talk about MPV and the impacts and disproportionate impacts that it's having on the LGBTQIA+ community, and destigmatizing MPV as an LGBTQIA+ only virus, which it is not. And so also appreciate Dr. Easterling for joining us today and sharing the facts. And thanks to all of my colleagues.
Thank you, Councilmember Hudson. Councilmember Feliz.
Good afternoon, everyone. So good to see all of you. Thank you all for being here. I'm Councilmember Oswald Feliz. I proudly represent District 15 in the Bronx, which covers areas of Fordham Road, Grand Concourse, East Tremont, Allerton, and so many other areas. And, you know, we've made so much progress, especially on the issue of the coronavirus. 2 years ago, many of us were stuck at home. We were scared. Our businesses were forced to shut down. And we've made a lot of progress, specifically because of all the measures that we've taken, including wearing face masks, encouraging coronavirus vaccination. And, you know, we are here today because of the many measures that we took. And we need to continue going the direction that we're going, continuing to improve. We could only do so by getting vaccinated. You know, our schools, or actually any place of our city could, you know, the coronavirus could easily be transmitted, whether it's on the train, because trains get extremely packed. I will never forget those train rides on 3rd Avenue and Grand Concourse, where people could barely move in the train station. And we know that the coronavirus pandemic is still a thing. Coronavirus could be easily transmitted, and the best way to fight against it is by getting vaccinated. So, you know, I'm here to say that I'm fully supportive of all the measures that we've taken, and also to encourage everyone to continue taking the measures that we've taken so that we could all be safe and we could all continue the progress that we've done. So thank you so much.
Thank you so much, Councilmember Feliz. We have Councilmember Caban next.
Thanks so much. I just want to extend gratitude to my colleagues, obviously, but the depth and the most gratitude towards the folks who have decided to be here and participate and listen and learn from this discussion. I just want to hit, a couple of points because I don't want to repeat anything that has been said, but we are very much so at the intersection of multiple, virus pandemics. COVID-19 is still a very real threat, and we are contending with the reality that long COVID is shaping up to be and will continue to be one of the most mass disabling events that we have seen in our lifetime. And so it's really important to, on the front end, make sure that we are preventing infection and doing what we can to take care of each other. And MPV is, one where it is especially important to make sure, to my colleague, Councilmember Hudson's point, to destigmatize and to lead with care and compassion so that we are reaching folks who are the most vulnerable for contraction so that they get vaccinated. And that means people who work in fields that require lots of physical touch, from massage workers to sex workers to everything in between, and just taking a care first and an outcome driven approach to tackling both of these pandemics. So really appreciate being able to be a part of this. Thanks so much.
Thank you so much, Councilmember Caban. We have Councilmember Bottcher.
Hi, everyone. Really happy to be here. I want to thank Lynn Schulman, the chair of the Health Committee, for her great leadership during this MPV crisis and so many things that are happening right now in the field of public health. I really, really think the council has been a standout leader during this really difficult time. Also, with the leadership of the co-chairs of the LGBT caucus, Councilmember Caban and Councilmember Hudson. I'm very proud of this caucus and all the work that's been done, including on the MPV crisis with the package of legislation that was introduced and all the other work. And Councilmember Feliz as well, great to see you. I wanna, and Councilmember Joseph, the chair of the Education Committee. I wanna shout out my friend Jeffrey Galais, who's here, who has been a very brave and outspoken advocate on the issue of monkeypox and MPV, and who came forward very early as someone with MPV and spoke very bravely and openly about his experience. And I think his efforts have helped and are helping a lot of people. So I'm really, really happy that he was able to join us today. And I really thank everyone who's here for this forum today. Thank you so much.
Thank you, Councilmember Bottcher, and thank you to all the council members who were able to join us today. We truly appreciate your participation. We will now have a member of the community join us to share his experience of surviving MVP. Welcome, Jeffrey Galais.
Good afternoon, everybody. Thank you, Councilmember Bottcher. I really appreciate everything that you and all the council members have done to support the community through MPV and me personally. So I'd be a loss without starting with that. I experienced MPV symptoms in July, and at the time, there was a lack of information and knowledge about how to treat symptoms for MPV from healthcare professionals, from clinics, and from hospitals. This left many, many sick people with nowhere to turn, hurt and in pain and helpless. They did the same thing that I did. They went to their social media, and many people flooded my social media inbox with terrifyingly scary messages about the symptoms that they were experiencing and the lack of support that they were getting from the federal government. And so I created a support group that meets, at the time it met every day. It meets Tuesdays and Thursdays now. The virus lasts a long time, so the period of isolation is extensive. And I knew that if I wasn't able to find the support that I needed for me, being very similar to Councilmember Joseph being an educator, I am also an educator. I knew that I have the responsibility to create that for my community. And I knew that this virus wasn't going anywhere. So what I've learned from this experience is that that this is layered, right? And that it's not only the physically debilitating symptoms that folks are experiencing, but also PTSD from folks that live through AIDS, extended isolation, also PTSD from COVID isolation, relationship drama, stigma, and then what happens when we transition back to life, on top of the guilt and the shame that one feels and experiences when going through this. So I just want folks to know that if they do know somebody who is going through this, they do not have to experience this alone, and that the community is here to help and support. So with that, I'll pass it back to the facilitator.
Thank you so much for bravely joining us and sharing your experience. Now we will have a short presentation by the Department of Health and Mental Hygiene's first Deputy Commissioner, Dr. Torian Easterling. Thank you, First Deputy Commissioner. The floor is all yours, and immediately following will be a Q&A session.
Thank you, Jasmine. Good afternoon, everyone. It is such a pleasure to be with you. I want to thank Speaker Adams for holding this space to allow for dialogue, conversation, allow for questions to be answered. Particularly also want to thank not only Speaker Adams, but the entire City Council for your leadership and your collaboration. Not only for MPV, but as we've already heard, there are a number of different parallel public health emergencies that we are facing right now. And it is required unprecedented collaboration. And so we continue to work with our City Council members to make sure that we're not only getting out factual information, but the resources needed to keep ourselves safe, as well as our loved ones. And so certainly want to thank the Chair on Community Health, Councilman Shulman, the Chair on Committee on Education, Councilman Joseph, as well as the co-chairs of the LGBT caucus. Really want to thank all of you for your collaboration. Really important, Councilman Hudson, Councilman Cavan, Councilmember Bottcher, and as well as Councilman Feliz. Thank you. With that, I'm going to ask one of my colleagues to project the slides, and we will try to move through them with some type of swiftness, because I know in these spaces, really the questions are really the important part, because we want to make sure that folks are getting the information that they are looking for. We're going to try to do some top lines to make sure that folks have an understanding of what we're dealing with in New York City as it relates to MPV. And you'll hear me say MPV, particularly because I think that there has been a lot of questions and concerns with the use of the nomenclature related to monkeypox. Monkeypox is the nomenclature, is the name that the World Health Organization uses for this virus. It is not related to chickenpox. It is related to the smallpox. It is part of the orthopox virus clan, but there is active discussion about changing the name, particularly because of the longstanding stigmatization, racial discrimination around how we think about, the use of the term monkeys. And when we also know that monkeys are not actually the exact reservoir vector that actually transmits this virus. And so there's a lot of questions around the use of the name. And so we use MPV really to make sure that we are conscious around language. So with that, let me move forward and just give some top line. So what is monkeypox? What is MPV? It is a contagious disease that is actually caused by this virus that's within the orthopox clan, as I mentioned. And what's concerning about this particular virus is that we're seeing this virus in countries, in over 90 countries where we have not previously seen it. This virus actually is endemic in other parts of the world, but now we're seeing over 40,000 cases in so many parts of the world where we have not seen it before. And as a result of the presence of this virus, several jurisdictions, including New York State, New York City, as well as the federal government, have declared an emergency declaration, ensuring that we are mobilizing resources, we are mobilizing all of government to make sure that we are stopping the spread of this virus. Next slide. And so what we're seeing in the US, and just so for awareness for everyone that's on this call, we actually have regular communication with the White House command, both the director and the deputy director of the MPV response, Bob Fenton, as well as Dr. Dimitri Dakalakis. We work with them on a constant basis, really to make sure that we have all of the resources that we need at the local level, and also understand and do forward planning to make sure that we are thinking ahead to ensure that our response is coordinated with the federal government. What we're seeing across this country is over 18,000 cases have already been reported. We're seeing them in all 50 states, plus Puerto Rico and DC. We have over 3,000 reported cases here in New York City, and in all 5 boroughs as well. You sort of see the case range across the country, but know that all 50 states, plus the territories that I mentioned, do have cases as well. Next slide. What are the symptoms for MPV? Usually they start within 3 weeks after exposure to the virus. The most common symptom, I think, as already been heard and discussed, is rash or sores. They can present all over the body, or they can present in certain parts of the body. Areas that are more common are the face, hands, or feet, or inside or around the mouth, genital, or the anus. They have certainly been reported to be extremely itchy and painful. It can last from 2 to 4 weeks. In addition to the rash and sores, individuals have also reported flu-like symptoms, fevers, chills, swollen lymph nodes, headache, body aches, etc. Although not as common as the rash or sores, but certainly can present at the same time as the rash or sores, or much later. Next slide. And what we're seeing as far as transmission during this outbreak, primarily direct prolonged contact. I just want to make sure that is said up front. Particularly oral or anal or vaginal sex, we certainly have seen or have heard exposure through those routes, as well as other forms of intimate contact, rimming, hugging, kissing, or biting. And so I think it's really important to understand that it's not only direct, but it's prolonged, and really exposure to rash or sores of someone who actually has the virus. Contact can also happen through clothing or bedding or other types of materials like towels, other items that individuals use, particularly again, if it has been exposed to the rash or sores of someone who has that virus. So it's really important that if an individual has confirmed positive for MPV and has the presence of sores, and those sores definitely need to be covered up, and we need to minimize and limit any type of exposure to anyone else to those rash or sores, and extra care must be taken to make sure that proper handling as well as cleaning does take place for any of the materials that they're using, their clothing, their bedding, their towels, etc. Next slide. So who is at risk? And I do want to emphasize something that Councilor Hudson did mention, that anyone of any sexual orientation can get monkeypox, so can get MPV. This is really important, and we try to be very clear about this. And although right now what we're seeing, most of the cases in the US and other countries are specifically showing up in the LGBTQ plus community, but I think we need to be clear, and we have seen, particularly already in New York City, with one pediatric case, that anyone, regardless of their gender identity or sexual orientation, can be exposed and infected with MPV. So I think what we want to be sure is that everyone has information about how they can be safe. we certainly know what the risk factors are, particularly because of where and how MPV is transmitting in this country and particularly in this city. And so our message is all about prevention for everyone. And certainly identifying what those risk factors are is also important so that individuals can then take the necessary steps to also protect themselves as well. Next slide. So to that point, how do we protect ourselves, yourself, and also your sexual partners? And so we've been very clear that we want to be clear, put out our prevention message, but also how do we reduce risk? We reduce risk certainly by avoiding sexual activity, particularly with multiple partners, anonymous partners, avoiding certain sex parties, circuit parties, particularly where individuals are having intimate contact with people they do not know or multiple people. Certainly having conversations with partners as well, particularly if symptoms are known, if someone has a known sexual history. All of these things are really important, and particularly it's positive sex information that we want to get out because yes, we want individuals to avoid sexual or intimate contact at this time, particularly if they are engaged in multiple anonymous partner sexual activity. But if they do not, then there are other ways to protect yourself as well. And that's what we want to really get out. Here are all the ways that individuals can really protect themselves as well as their sexual partners. Next slide. So who should get the vaccine? Right now in New York City, we have administered over 70,000 doses of the JYNNEOS vaccine. This is the only vaccine currently that has been approved by the U.S. Food and Drug Administration for the prevention of MPV in children that are over the age of 18. We do know that vaccine supply continues to be low, not only for New York City, but for the entire country. What we have learned from COVID is that it's a four-part harmony. We need supply, we need access, we need demand, and we also need to ensure that there is confidence around the vaccine. That is how we ensure that equity is the center of our campaign, but also that we're able to really reach our public health goals and ensuring coverage across this city. And while supply remains low, we have really been working on our access points across this city. Right now, vaccines are eligible for individuals that are 18 and older, and really are part of the community that I already mentioned, identify as being within the LGBTQ community, or men who have sex with men, but also have multiple sex partners, anonymous partners as well. And also we have outlined the number of sex partners as well. We are looking at how we're going to expand that eligibility over time. And it's really important that we continue to do so because we want to make sure that individuals are being protected from MPV. In addition, we do reach out to individuals who are close contacts of known cases, in addition to doing our prevention message. And so we do a lot of that outreach through our disease investigators. So if there's a known contact, someone will be contacted and then they're connected to one of our vaccine clinics so that they can receive the JYNNEOS vaccine as well. Next slide. So if someone has symptoms, they should certainly call their healthcare provider. If they do not have a healthcare provider, certainly call 311 or check our NYC Health Map. We're connecting individuals to our colleagues at NYC Health and Hospitals. These are ways in which we are ensuring testing and treatment is available. Although we spoke more about about vaccines, treatment is something also that is available, particularly for those who are already exposed and infected from MPV and needs relief from rash or sores. And so we have seen that the treatment that is available, the antiviral treatment, TPOXX that is available, has shown to provide relief for individuals who are affected with MPV. Next slide. So what is the city doing? So there are a number of things that we are focused on right now, particularly with any public health emergency, any communicable disease outbreak. Really important that we have our surveillance infrastructure in place. so that we can sort of see what is happening with transmission. How do we really direct our resources? So we continue to do that. And partly that's working with our healthcare systems to understand where we're seeing most of the cases throughout this city. And also working with our public health laboratories. One of the things that we've done is expand testing in this city, not only through our public health laboratories, not only through New York City Health and Hospital, but also through commercial labs. And this is important because everyone does not go through NYC Health and Hospitals. And so now we have our providers that are able to do testing for MPV as well. As I mentioned, our disease investigators, our contact tracers are calling individuals, doing case investigation, finding out individuals, how they are exposed, if someone else is exposed, and how we can make sure that they're getting the resources that they need. Across the city, we have a number of different vaccine clinics, our sexual health clinics, NYC Health and Hospitals, both brick and mortar as well as mobile clinics that have been stationed across the city, in the Bronx, Staten Island, as well as in Brooklyn. All 5 boroughs have mobile clinics, making sure that we're not only doing partnership with our CBOs, but we're also partnering with events and making sure that we are providing services well into the late hours of the night to ensure that individuals are getting access to the vaccine as well. Messaging, partnership with community partners, all of these are different strategies that we know have worked during our COVID campaign. And really getting out it like a historic campaign like the COVID vaccine, making sure that there has been collaboration across this city. And of course, leveraging spaces like this that has been curated by our city council to ensure that we're getting out factual information. Next slide. So we ask that we continue to push out the right message. And there's a lot of accurate information on our website. And I would like individuals, direct people to go to the NYC Health Department website, the CDC website as well. You can also text alerts at 692-692. Texting, it is using the nomenclature monkeypox. We're putting out palm cards, any way that we can support and collaborate with your organization to get message out, whether digital or also in print. We want to continue to work with you. But we also know that individuals do feel shame as it relates to this virus. And so we want to continue to also provide services as it relates to NYC Well. Free mental health counseling and referrals are available in over 200 languages. And so we do also encourage individuals to put out that information, calling 888-NYC-WELL or texting WELL to 65173. And so with that, we'll close. I think there's no other slides, and then we'll move forward with Q&A. But one last point, as we prepare, as we arrive at the end of the summer, and so I will say, happy September to everyone and prepare for Labor Day. I think it's really important that we know that we're also putting out school guidance related to COVID-19 preparation. Our at-home test kits are going to be distributed first day of school. We also have guidance as it relates to MPV as well on our website. And so it's really important. I really appreciate all of the council members really underscoring the emphasis on getting vaccinated. We have to make sure that our children, all of us, are vaccinated, not only for COVID, but also for polio as well, and MPV if you are eligible. I think that we know that vaccines are safe and effective and really have been keeping us well during these challenging times. And so with that, I'll turn it back over to the moderator.
Thank you, Dr. Easterling, for your insightful presentation. We do appreciate you joining us today. Before we continue our chat and chew conversation, I'd like to invite Council Member Farah Lewis to say a few words.
Good afternoon. Sorry, I had to have my camera off because of my background. I just want to thank the speaker and all of our chairs for the opportunity to have this conversation that we're having today. I'm really grateful for this, especially with the West Indian Carnival coming up, making sure that we're preparing our constituents, our cultural practitioners as a whole, regarding everything happening with MPV and COVID. So thank you for the opportunity, and I'm going to yield back to the facilitator. Thank you.
Thank you so much, Council Member. We are going to continue our Chat and Chew conversation, and I'd like to welcome my colleague, Frank Hulka.
Thank you, Jasmine. Thank you so much. And thank you, Dr. Easterling, for that very informative presentation earlier. And good afternoon, everyone. My name is Frank Hulka, and I am a community liaison at Speaker Adrian E. Adams's office. And I will be moderating the Q&A section of this Chat and Chew session. Members of our panel, I now invite you to answer the following questions. Many of the advocates have sent in questions about these public health concerns. So let's get started. The first question that we received is, since we now have juvenile cases of MPV infection, what are the modes of transmission for this infection?
So the modes of transmission, as I mentioned during the presentation, certainly direct contact with rash or sores of someone who has the virus. It can also happen through bedding, clothing, or towels. And so really important that we identify if someone has or is infected with this virus, because then we can take the right steps, right precautions to make sure that they're isolating and not exposing someone else. And so that's one. And as we mentioned, we are seeing most of our cases, particularly within the LGBT community right now, but we know that anyone can get this virus. And so it's really important, one, that we know all of the ways in which we can identify if we've been exposed or if we're infected, so that we can then alert other folks in our family, right? And I think that's what we've seen with the pediatric case. This is a household contact. Someone already was exposed, came into the household and exposed the young adolescent. So that's why it's really important that we have information, we use testing appropriately, we notify everyone that is in direct contact with someone who has been exposed, so we can take the necessary steps to prevent anyone else being exposed.
Thank you, Dr. Easterling, for that answer. And I believe you mentioned rash and sores in your answer, and that sort of connects to the question that we have now from Mary Ellen Novak on the audience. So she is asking, does the rash sores show up where there was contact on the body, or does that not matter?
Ultimately it doesn't, but in most times that is what happens. But it can happen. But you can be exposed to a rash and sores, direct contact to a specific part of the body, and then see those rash or sores show up all over the body. So not 100% of the times will it just be limited to the location in which was exposed.
Awesome. Thank you for that answer again. The second question that we have from one of our advocates is, since the city has moved forward with the 1/5 dose of the MPV vaccine, how are you working to educate people in a way that doesn't incite distrust?
Yeah, no, this is a really important question. And so, just to take a step back, the federal government, because of, the low supply of the Jynneos vaccine, made a decision to move from subcutaneous to intradermal administration. We have moved as a city to intradermal administration for all of our public appointments. In the event that someone has a history of keloids or some other skin condition, that individual can still request for a sub-Q administration. So I do want to make sure that individuals are aware that there are some people who are eligible for sub-Q administration, subcutaneous administration. But as far as working with our messengers, with our healthcare providers, one of the things that we did, we really spent some time working with our providers across the city, doing trainings, virtual trainings, in-person trainings around intradermal administrations. There's been quite some time most providers have been able to do this. And so the trainings were really, really important for our own sexual health clinics, as well as providers who are offering the vaccine as well. And then we've been working with our community-based organizations, both funded and non-funded, trusted messengers across the city, to ensure that they're getting message out. They're, through the palm cards and through their outreach and engagement, also sharing why it's still really important, and it provides immunity by still offering the intradermal administration, just to make sure that we're answering those questions that individuals may have. And I think ultimately what we know is that, even with this change, that we're still offering an opportunity to protect individuals, to keep folks safe. And I think that that's what we have to continue to underscore as well.
Thank you, Dr. Easterling, for that clarification. We have another question from one of the advocates. How have agencies prioritized community safety and health during the ongoing crisis? This question also connects with something that Sharon Spence is currently asking as well, which is, will COVID-related as well as MPV-related information be made available at the upcoming Labor Day festivities? And how will the information be disseminated? Just like a community safety question.
Yeah, so I can absolutely say, just to the second part of that question, yes. We have already been working with, many of our sister agencies to make sure that they are co-administering a lot of the information, or co-distributing a lot of the information related to MPV, and continue to get out messaging around COVID. So absolutely. And we still have many of our H&H Test to Treat vans across the city. And so continue to encourage individuals to use those resources as they're available. And then, around public safety, I think that this is a really important conversation, particularly around this time with Labor Day. And I think it's making sure that we have, we're going to be having our staff across the city out engaging with folks, really trying to make sure that individuals know how they remain safe, connecting them to resources. And I think this is what we continue to focus on, particularly around Labor Day, making sure that those partners and our partnerships are out there to engage the community.
Thank you, Dr. Easterling. We have another question, this time from the live chat. This is from Anthony Lorito Duke, and he is asking, when will DOH-MH finally tell all of the clubhouses throughout New York City that the mask mandates are fully lifted?
Yeah, thanks, Anthony, for the question. This is an active discussion, and it's an active discussion not only at the city level, but also at the state level. We are, we're in conversations with the governor's office, particularly around some of the mask mandates that are in place that are set by the state in certain settings, particularly where we know that there are individuals who are most at risk to COVID-19 exposure, healthcare settings, congregate settings, also thinking about correctional facilities as well. And so when we think about the clubhouses, because of the nature of the environment, close quarters that they offer, you would consider the clubhouses certainly being a space where you have to think about risk. And so right now, even as we see decreases in cases and hospitalizations for COVID-19, we still cannot take our foot off the gas just yet. We're going into the fall. School is about to reopen. The possibility of a new variant is always going to be looming at this time. So all I can say right now is it's an active discussion. We haven't made a final decision about mask mandates in those settings where we are most concerned, particularly about those who are most at risk for COVID-19 exposure.
Thank you, Dr. Easterling. One of the questions that we're also getting from the live chat, and also it's again connected to one of the questions submitted by one of our advocates. This question is from Orbit Clanton, and Orbit is saying, how soon will those of us who have received our first monkeypox vaccine dosage be able to get the second shot? Also, one of the advocates asked, will there ever be a second vaccine for MPV?
So Yes, for a second dose. It's a Jynneos vaccine is a 2-dose vaccine. And so we do know that, like the Pfizer and Moderna, which is a 2-dose vaccine to prevent spread of COVID-19, the Jynneos vaccine also, when you think about the primary series, it requires both doses. So the announcement is coming soon. I cannot, sort of preview, when that announcement is going to happen, but it's coming very, very soon. Our process here at the Department of Health, we're going to be reaching out to individuals who've already received their first dose, contacting them, and that's going to be through text message, email, and phone calls, letting them know when they can return for their second dose.
Awesome. Thank you so much, Dr. Easterling. Yeah.
And I should also add, because I think the other part of the question was also the bivalent COVID vaccine. And so, as most people may already be aware, the FDA has authorized approval for a bivalent COVID vaccine. We're still waiting for additional guidance from CDC, which is happening actually today and tomorrow, followed by clinical guidance that will come out early next week after Labor Day. And so we do expect that as a city, we'll be ordering bivalent COVID vaccines over the next 2 weeks. And then we'll begin to announce, where individuals will be able to get their bivalent COVID vaccine.
Thank you. We are also again getting another question from the live chat, this time from Lynette. She is asking, we are still in allergy season and the skin rash flare-up resulting from some allergy types. Can you describe the type of rash? I'm assuming this is concerning MPV. And are there any samples of what rash outbreak looks like?
Absolutely, yeah. I mean, this is why we have photos on our website as well as the CDC to show the pimples or blisters that are that are more common with the MPV virus. But you're absolutely right, and this is why with our school guidance, we do ask that providers and that school staff are really judicious and sort of raising the alarm that something is MPV, because we know that children are exposed to Coxsackie virus and have all these other viruses that they have to deal with. And so we want to make sure that we do proper testing before we confirm or and really have high suspicion for MPV. But yes, we do have some of those photos up on our website.
Thank you, Doctor. Another question submitted by one of the advocates was, are the COVID vaccinations and boosters of any preventative help in relation to MPV?
Are the COVID vaccines, I'm sorry, can you repeat the question?
Yes, of course. Are the COVID vaccinations and the COVID boosters of any preventative help in relation to MPV?
No. This is a totally different virus. The SARS-CoV-2 virus, which is the virus that causes COVID-19, is a different virus from the orthopox virus or the MPV virus that causes as it relates to monkeypox.
Thank you. Thank you for that clarification for the audience. And another question that they've also submitted is, does one have to have symptoms in order to receive the MPV vaccination?
Do you have to have symptoms? No.
Yeah, no. Yes. Perfect. So we also have another question from the live chat. How are you planning to improve access for New Yorkers who do not speak English or Spanish? This is mostly about vaccination access.
Yeah, it's really important. All of our palm cards, all of our messaging has been translated to all of the languages. There's most commonly spoken languages plus other languages commonly spoken in New York City, including Spanish. And so, and it's not only through what's on our website, but also making sure that we have interpreters at our vaccine clinics. Also working with a number of our community-based organizations, and who are in various parts of the city, ensuring that individuals are speaking in different languages or engaging community members so that folks know what resources are available.
Thank you. Thank you, Doctor. I'm going to be doing a time check and see that we are almost out of time for today's Chat and Chew. I do believe that we have a few more questions, so I'm going to ask them. But again, I just want to reiterate that if we did not get to your question, please note that follow-up responses will be available. So we do have time for a few more questions. One of the questions that we got from the live chat is, how are you improving test results turnaround? This is also connected to the second doses question concerning MPV, as well as what is the max time someone can go for taking your second dose?
So for the first question, so testing turnaround time is really good, particularly for COVID. And also this is why we're distributing our at-home test kits so individuals can have access and they can test themselves immediately and use the rapid test kits. And then also having access to PCR testing also has been really has improved over time because we've also improved our lab capacity. And then particularly around our MPV testing, certainly the initial testing, because there are sort of two steps. We do initial testing, at our public health laboratory, at our commercial labs, and then there's a confirmatory test that we also do for someone that is highly suspicious of MPV after the initial test is done. And so we typically get results back within 24 to 48 hours for that initial test, and then following up with a confirmatory test. So this is why we continue to work with our federal partners to expand lab capacity, testing capacity to ensure that we've improved upon turnaround time.
Thank you, Doctor, for that answer. The second question, almost the last question that we have is, what are you actively doing to keep us safe in the subway and public transportation and to keep our kids safe in school? I'm assuming this is also not only MPV, but also COVID related.
Yeah, so the health department is one of the agencies that partners with DHS and NYPD as part of the mayor's public subway plan. And we have seen an increase in individuals being connected to a DHS shelter, being connected to mental health resources. And so this is the way that we want to take away that stigma that, these are certainly, New Yorkers. We want to make sure that we're connecting them to resources, but also keeping New Yorkers safe as they are accessing public transportation. And so this is just one approach that we continue to engage on. In addition, we're working with many of the same agencies, doing joint operations and making sure that we are prioritizing certain areas where we're seeing high numbers of syringe needles and syringe litter, making sure that we're engaging individuals who may be unhoused, maybe at shelter, making sure they're also getting connected. And we've been doing this over the summer and even prior to that as part of a joint operation. And I think these are the type of collaborations during this administration that's really allowed us to really target our resources in these ways. And so we're going to continue to do that and reassess certainly as we go forward into the fall.
Thank you, Dr. Easterling. Just want to squeeze in one last question. We're definitely trying to get to all of the questions from all of our attendees. The last question that we have is from Anthony Loredo Duke. And his question is, since different illnesses can have similar symptoms, how do providers diagnose what the exact illness is?
Yeah, so I mean, this is a really good question, but I think this is the art of medicine, and usually, a provider is going to ask the salient questions of the symptoms and signs that someone is experiencing, the timeline, any exposure that someone may have been exposed to, and I think these are the ways that we sort of gather that information. The physician comes up with a differential diagnosis based on the information that's been gathered, in addition to any testing that is needed, the physical examination, all of this information, it's helpful in then sort of thinking about what is the most likely diagnosis that the individual may be contributing to what's happening for that individual. And so that's the process. And most physicians usually take that course, and sometimes you may have to rely on additional specialties. But overall, our public health surveillance, our public health laboratory, these are all ways that we use information to better understand how disease transmission is happening, if there are any signals, and we certainly do this, certainly during the flu season, to see how the flu activity is beginning to trend during flu season, and so that we can get information out to New Yorkers, and individuals can really make sure that they're doing all the things they need to do to remain safe. So, that's really why it's really important that our public health infrastructure is strengthened, so that we can use our infrastructure in a way that pulls in that information, but we're also able to distribute that information, and New Yorkers can use it better to understand what their risks are and be able to make the decisions how to keep safe.
Thank you. Thank you so much, Dr. Easterling. And thanks again for taking the time to answer all of these questions in a very informative and insightful manner. And again, if we did not get to your question, we want to again reiterate that we will be making follow-up responses. They will become available. And now we will be displaying some important information on where you can go to get vaccination information and stay up to date with these public health concerns. Again, I want to thank all of our panelists as well as our attendees for joining us on our first ever Chat and Chew session, and have a great rest of the day.